So welcome all students to my next session of about ECG. So I'm going to take class about the ECG. So the full form of ECG is electrocardiogram, and the proper definition of ECG is that it records or recording of all the action potential by nodal and contractile cells in the heart at a given time. So the not only the single action potentials that generated by the AV or SA notes all the action potential that are generated by the nodals and the contractile cells in the heart at a given time. So all the recordings are is developed and stored by evaluated by the ECG or the electrocardiogram at a single time. So next point is it is not a single action potential. So it is not ECG is not taken on a single action potential. It is taken from the SA node at the same time. It is taken from the AV node at the same time. It is taken from the bundle of his at the same time, or the transmission from the same time. So it is not a single action potential. So next point, it's saying that a lead refers to the combination of electrodes that form an imaginary line in the body along which the electrical signals are measured. So in ECG they use LEDs. LEDs means electrodes. So in this LED they use absorption for that electrical absorption signals are absorbed or measured by electrodes or LEDs. So next point, there about the LEDs. A total LED ECG usually only uses 10 electrodes. So total LED ECGs uses 10 electrodes. So next is the graphic output of ECG. So the x-axis is considered time and the y-axis amplitude means voltage of the current generated by the action potential. So it is proportional to the number and size of cells. So the action potential, so voltage generated is proportional to number and size of cell. So x-axis is time and the y-axis is proportional to the number and size of cells, and size of cells. So it is the voltage or the graphic output of amplitude. Next is understanding waveform. So the waveform, as you can see in the illustration, shows possible direction of electrical current or depolarization on a LED. The direction of the electric current determines the upward or downward deflection of an ECG waveform. So you can see the ECG waveform. So there contains a depolarization, there contains a repolarization. So all this direction of the electric current is measured, determines the upward or downward deflection of ECG. So when the ECG is low or the negative value, the ECG is, as you can see in this picture, in this direction it is downwards, and it is above the negative value, it is slightly up and down. Next is it's a ground ECG wave, and in this it is a small ECG ground, and in the opposite it is upward, exactly in downwards. So it's positive and negative. So from the direction you can see. So the first waveform in the negative may caused by depolarization of sodium ions. Open channels of sodium ions can cause depolarization. So The first ECG is as current travels towards the negative pole, the waveform deflects mostly downwards. So the waveform is deflected downwards when the negative pole, when the current travel towards the negative pole. So the current passes through the negative pole, the ECG goes down. Next is the middle one, when the current flows perpendicular to the lead. So this is an electrode. You can see this is a electrode. It has a positive and negative ends. So when it is perpendicular to the electrode, the current flows perpendicular to the lead or electrode. The waveform may be small or go in both directions. So the middle one is biphasic. It goes up and down. So when it is perpendicular to the lead, this ECG is both biphasic. Biphasic means it shows both direction forms. Biphasic. Next is the positive side of the lead. So as the current travels towards the positive pole, the waveforms deflect mostly upward. So the current travels towards the positive pole, the waveform deflects mostly upward. So the waveform is exactly the opposite of negative current flow. In this the waveform deflects mostly upward. So next is the ECG waves. So the ECG waves are contains of four different types, seven different types. So the first one is P wave. So in P wave, as you can see, there is depolarization of atria, the P wave. So it is depolarization of atria. So the presence of these waves indicates the SA node is working. The presence of this wave indicates the SA node is working. So the depolarization of atria is the formation of first wave, the P wave. So it shows the presence of wave indicating the SA node is working. So the SA node is situated in the atria. So the P wave is situated inside the and is formed from the atrium or the location of SA node. Next is as you can see, this is the point of production of the SA node, and this you can see the waveform. It is downwards. Now it is depolarization. So we have to understand how it works. So next is the PR segment. We said about the first wave, that is the P wave, which is formed from the P wave, which is formed from the depolarization of atria, or it is presence of wave indicates the SA node. Next is the PR segment, PR. So after the P wave, it comes the PR segment. So it is reflects the delay between SA node and AV node. So PR is the point where the SA node and AV node has delay. So it reflects the delay between SA node and AV node. So from the SA node, it produces about 100 to 90 bpm, 90 to 100 bpm per minute. So after the 90 to 100 bpm per minute, the 60 40 to 60 about in AV node is produced. So the delay in between them is recorded in PR segment. Atrial contraction is occurring at this time. So first wave, what is the function of first wave? It helps us to identify that the SA node is working. What is the function of the second PR wave segment? It's the PR wave segment helps that the atria is constriction. It is in constriction. So that is about PR segment. Next is the Q wave. The Q wave is the intraventricular septum depolarization. So after the reflection and the delay of SA node and AV node, there comes the depolarization of intraventricular septum. So Q wave denotes the depolarization of intraventricular septum. So it is a wave direction. As you can see, the blue arrow is perpendicular to the main electric axis and result in a biphasic trace. So this wave, this P wave, Q wave is biphasic trace. As a biphasic, we can see the biphasic, it is in the middle. So so we can see the exact wave position or the direction. It is biphasic trace. It is showing a biphasic trace or the ending of biphasic trace. So result in a biphasic trace. So the wave direction, see the blue arrow, is perpendicular to the main electrical axis. So the blue arrow shows electrical activity in intraventricular septum and is perpendicular to the main electric axis. So the electric axis, when it is perpendicular to the electric axis, it shows biphasic trace. So only negative deflection is seen due to signal cancellation by atrial repolarization. Only the negative deflection is seen due to signal cancellation by atrial repolarization. Sometimes the wave isn't seen at all. Sometimes the wave is not even present. So it is very hard to identify the P wave. So the first wave is the P wave. Sorry, it is very hard to identify the Q wave. Sorry about the P wave. So the P wave, after that there goes a straight wave, the PR segment. In the PR segment, what happens? In the PR segment, the atrial and the SA node and AV node dilation is recorded or reflected in the atrial wave. So in the PR segment, and after that there forms a Q wave. Q wave is biphasic. So it forms a biphasic. So it is seen in the intraventricular septum and it is formed from the depolarization, and the blue arrow is perpendicular to the main electrical axis. So where is the main electrical axis? You can see the blue arrow is going inside towards the septum. So it is perpendicular. So this wave is perpendicular to the main electrical activity or axis. So it results in biphasic trace. So if there is a negative deflection is seen in the Q wave, it is due to the atrial repolarization. So if in the PR segment the atrial depolarization is occurring. So in the P wave the depolarization of its atria is occurring. So if there is a negative deflection in the if the negative deflection is seen in the atrial repolarization, it is due to the atrial repolarization. So in PR segment there is SA and AV node delay, and there is atrial contraction occurring. First, from the setting we can say the P wave, it is where the atrial depolarization occurs, and after that atrial contracts, and after in the third wave, Q wave, there may be if there is a negative Q wave, we can show that the atria has repolarized. Sometimes this wave is not even observed, the Q wave is not easily observed. So next is the R wave. After the Q wave there comes the PR, Q, R. So it is very easy to understand. PR, Q, R. So in the R wave, the fourth wave, there is ventricular depolarization. So after the atrial repolarization, signal may be cancelled. So in this, we can see the blue arrow, it is going downward the Purkinje fibers. So where is electrical axis? Electrical axis is not perpendicular, or it may be parallel. So when it is parallel, it shows increased positive form, or the waveform deflection upwards. So the waveform deflect upward, that is the R wave. So every time we have to say the R wave means positive side of the lead. So it is the positive pole, the waveform deflect mostly upward. So the R wave has a positive pole, or the it is due to the ventricular depolarization, and the wave direction is same as the main electrical axis. So wave direction is same as the electrical axis. So in this Q wave, the wave direction is perpendicular to main electric axis. In wave direction is same as the electrical axis. So perpendicular means 90 degree. When it is same, it is we can say it is same. So the main electric axis is same, and positive deflection is occurring. So the wave hits positive deflection in R wave. In Q wave there may be negative deflection, or the wave does not even be seeing. Negative may be due to atrial repolarization. In the first wave, P wave, it is due to atrial depolarization, and it is seen in the presence indicate the SA node is working. In the PR segment, what happens? In the PR segment there is atrial contraction, and it reflects what? SA node and AV nodes delay reflection delay. In the Q wave, what happens? It is in the interventricular septum. So in the interventricular septum, what happens? There is depolarization. So there is depolarization in the interventricular septum, and this causes the Q wave, and it is perpendicular. And when it is perpendicular, what happens? There is a biphase. That is very important. If it is perpendicular, the source is biphase. We can observe from it. When it is perpendicular, this phase is biphase. So after that, the R phase is due to ventricular depolarization. So in this R wave, the ventricles are depolarized. So due to the and the main electrical axis is parallel to the wave direction. So wave direction and the main electrical axis is parallel, or in the same size, same direction. So it is positive deflection is seen. So R wave amplitude is largely due to the sheer number of depolarizing myocytes. So where we observed myocytes are observed in papillary muscles. Myocytes are observed in Purkinje fibers. Myocytes are observed in Purkinje fibers. So the R amplitude is large due to the sheer number of depolarizing myocytes. So the large number of shear depolarization myocytes. R wave amplitude, the amplitude or the positive deflection amplitude is largely due to the sheer number of depolarizing myocytes. So the myocytes are depolarized in the Purkinje fibers, are seen in the Purkinje fibers. So the R wave is complete. Next is the S wave. So PR segment, Q wave, P wave, PR segment wave, Q wave, R wave. Next is the S wave. In the S wave, it is depolarization of myocytes at the last of the Purkinje fibers. So in the S wave, the collection is from the depolarization of myocytes in the at the last of the Purkinje fibers. So the ending of the Purkinje fibers, the depolarization of myocyte is the starting of S wave. Wave direction, black arrow, opposes the main electrical axis and causes negative deflection. The wave direction opposes the main electrical axis. The wave direction opposes the main electrical axis and causes negative deflection. The wave is not always seen. So S wave is formed from where the depolarization from the last segment of the Purkinje fibers, depolarization of the myocyte is reflected on S wave. Wave direction is opposes the main electrical axis. So you can see the direction, it opposes the main electrical axis. So electrical axis is from and to the Purkinje fibers. So it opposes the main electrical axis. So there is downward motion or depolarization. So anywhere that is depolarization, the arrow will be downwards, or the end of depolarization, the arrow will be downwards. So this wave is not always seen. Next is the S. After the S wave, the S and the T segment. So there are segments in between wave. There are PR segment and ST segment. So if you understand the PR segment, you can also understand the ST segment. So the ST segment is due to the ventricular contraction is occurring at this time. So before this there was ventricular contraction, ventricular depolarization in R wave, and in this ST segment there is ventricular contraction. So ventricular contraction is reflected in ST wave, ST segment. So due to the lag between excitation and contraction, there is no electrical activity. So there is only a line. Ventricular contraction is occurring at this time due to lag between excitation and contraction. So there is excitation of the and the contraction is occurring at the same time. So due to the lagging, there comes a straight wave, that is ST segment. Next is the T wave after the ST segment. So the T wave is ventricular repolarization, the last one. Ventricular repolarization. So the positive deflection, despite being a repolarization wave, because repol waves travel in opposite direction to dipole waves. So the positive deflection, despite being a repolarization wave, because repolarization waves travel in the opposite direction to depolarization wave. So there is repolarization in T segment, T wave. So ventricular repolarization is occurring. So the positive deflection is happening despite being a repolarization wave. So despite being a repolarization wave, there is positive deflection because the repolarization wave travels in the opposite direction to depolarization wave. So the repolarization wave and depolarization wave is very important, that when it travels in opposite direction, the positive deflection is occurred. This positive deflection is occurred when the repolarization wave travel to the opposite to depolarization wave. You can see in the image the ventricular contraction is occurring, ventricular repolarization is occurring. So when the repolarization wave travel oppositively to the depolarization wave, there is positive deflection. So that's it, the end of ECG.